My name is Talbert. I'm a cardiac electrophysiologist, and I've joined the cardiology staff here at NPMC to practice cardiac electrophysiology. Cardiac electrophysiology is the study and treatment of heart rhythms, basically. I'm a heart rhythm doctor, and we train primarily in trying to learn how to diagnose abnormal heart rhythms and to deal with them and fix them. There's really three different groups. There's the pacemaker group can feel tired and weak and so on, have a slow pulse rate. And if you can document that they indeed have a slow pulse rate that's slow enough to justify it, then those people require a pacemaker. That's one group. Then the other group is the people who require an implantable defibrillator. These are people with weak hearts, usually people who've had multiple heart attacks and their heart function is less than half normal. And it's a pretty important thing is, again, those people are at high risk for dying suddenly, cardiac arrest, in other words, without any warning whatsoever. The other one is ablation. Those patients usually are people who have rapid heart rhythms that are very fast. They come on completely without any warning whatsoever. Heart takes off running very fast, and they can feel quite weak, and as I said earlier, can pass out. As I also said, their heart function get worse and worse, and they usually have a lot of shortness of breath and weakness and tiredness. If you have somebody who has other problems like COPD, emphysema, or congestive heart failure, or previous heart attack, or high blood pressure, or diabetes, or obesity, all those things contribute to your likelihood of having, and a family history of course, also those contribute to your likelihood of having atrial fibrillation. And that is if it's caught early enough, that can be treated and controlled very easily, and that is that's a big part of what we do. It's different from the rest of cardiology in that we're not opening arteries and fixing blockages. We're eliminating abnormal rhythms, and so you can try medicines in some of these cases. The medicines do not have a very good track record and have a lot of side effects. And then if you go on to ablation, that has a much better track record, and as a result you have a chance to fix people. So those are that's a big difference right there. That's something that Hot Springs hasn't had for forever really. And so as a result, don't have to leave town to get this. This is right here at NPMC.